So next talk is by Dr. Digvijay sir, and he is going to talk about establishing a super specialty practice. Sir is practicing neuro-ophthalmology and pediatrics in Gurgaon, and he is an alumnus of RPC.
Thank you. And so I'm going to talk about establishing a super specialty practice. So we know that ophthalmology is a number of specialties or super specialties, but a large chunk of that actually comes under the big comprehensive umbrella as well. So super specialty practice may not necessarily be purely a super specialty practice, and that has to be kept in mind. And that's because diseases don't know that they're a super specialty disease. If somebody's having decrease of vision, redness, inflammation, it could involve more than one specialties. So when we are looking at and you say that I just want to look at one thing, I want to focus only on one thing, then sometimes we may miss the bigger picture. But nonetheless, if you just want to be an eye doctor and you decide to be a super specialist eye doctor, then you have to make sure that the specialty you're choosing in has a requirement in that field as well. So, now, should we segregate? Definitely. If you're thinking of doing a super specialty practice, you should segregate. If you are in an institution in a group practice, then definitely you can do it. In community-based practices or general OPDs, it's a little more difficult. But if you want to segregate, even in that scenario, then you can divide your practice into OPD versus a clinic, where you can have a super specialty clinic, or you can have separate days for doing. Let's say I have about an hour or 2 hours a day where I'll call all my follow-up neuro-ophthalmology patients, because I need to see them with a certain frame set or mindset. It takes time to look at each MRI and things like that. And you can also segregate practitioners if you got more than one practitioner at your practice. So how do you go about doing it? And I think some of this Dr. Sunandani is already covered in terms of the human resources. So that's the first and foremost important thing. You yourself are a super specialist, and if you want to do it, you can hire more super specialists. But primarily, even the staff that you hire has to be trained. I do pediatric ophthalmology practice as well. So the staff I want has to be somebody who can interact with the children. The optometrist has to be somebody who can do a good retinoscopy. So that kind of becomes very, very important. The equipment also has to be specific to the kind of practice you're doing. If I am doing, let's say, a glaucoma practice, I have to make sure I do have an OCT, I do have a perimeter, I do have an appellation tonometer, and all these things become important. Similarly, the process is the appointments can be divided into a general appointment and a specialty appointment, and then your staff should know when to call the two. And the environment also should be, conducive for that. I mean, if you're doing a pediatric practice, you want to have an environment which is friendly to children. If you're planning to do a practice of, let's say, glaucoma, you need to have your dark room, you need to have an environment where your investigative labs are there. So that's important. But how do you go about doing it? So to begin with, if you're somebody who's just come out and you want to start off, freelancing is an important part of it. Let people know you're there, visit people, because at your own center you'll probably get very few cases, but you want your surgical hand and your training to go on. So move around, do freelancing. You can have a two-step OPD, you can have a general OPD, and then you can call the patient for a specialty consult after that, and that's important. Cross-referral is important. So tell people you exist, refer to people, the things that you don't do, and therefore you will get referral of things that you do. So that's very important. PR, in terms of projection to your peers, to your patients, to the public, this is all very, very important. You have to, if you are a glaucoma specialist, there is a glaucoma week, you need to be out there, you need to project yourself. Your patients need to know. Word of mouth is among the strongest in medical science. So if your patient knows that, if I've got a kid to show, I need to take it to this doctor, or if I've got a retina problem, this is the person I have to go to. And people are getting aware, so that's important. So the PR aspect of it is also very, very important. So peers, patients, public, and project yourself. So these important things are there. It's not moving to the next slide. Yeah. So I think to sum it up, super specialty, we can establish ourselves as super specialists, but remember, you cannot forget the comprehensive ophthalmology part of it. That still has to be there. So that, along with the cherry on the cake, which is your super specialty, is what you need to do. Your practice has to be patient-centric and individualistic. If you are somebody who's doing only glaucoma and and the eye, there are things that are beyond glaucoma. Uveitis could be causing glaucoma. You have to be able to manage both those aspects. You can't say go to XYZ and come to me only for the IOP. You have to have awareness of both. Yes, work in tandem with another super specialist who's looking after their uvea. But if a patient comes to you with an opinion that my eye seems to have become red, there's some congestion, you should know that I need to get him started on treatment and refer him to the right person. Establish protocols in your practice, so your staff knows. My staff knows, for example, that if there's a patient of squint, patient will walk in, They will do a PBCT, they will do a binocularity, they will look at his fixation, and they will not dilate till I have a look first at it. If it's a neuro-ophthalmology case, they would look at the RAPD on their own. They will get it to me if there's a doubt, and they won't just dilate, because these are things we often miss. I get a lot of calls for opinions from people saying that, do you think this was an optic neuritis? And I say, was there an RAPD? No, we haven't really seen it. So I think these are things again that tend to get missed out. So the protocol is very, very important. So at least as a super specialist, you shouldn't be the one missing those things out, and that's very, very important. And as I said, lastly, it's important to project yourself as a super specialist as well. You can't be doing everything and then still say I'm a super specialist just because you've practiced super specialty more. So you have to project yourself. This is what I do. This is my forte area. This is what your website, this is what your profiles, social profiles, your academics, whatever you do in conferences, your research, all of that should project that. But while keeping that in mind, don't forget the comprehensive aspect of ophthalmology, because the patient comes to an ophthalmologist first and a super specialist later. Thank you.
Thank you so much, sir. Dr. Gunjan is establishing her practice as a super specialist. So.
Yeah. So I have been to Dr. Digvijay's hospital, and I really want to tell everyone that how nicely he's managed all the practice, and all the proximity also knows that there's a pediatric ophthalmologist, because I worked nearby his center for long years. So Digvijay sir's practice is really commendable on that part, that the employees are happy, the patients are happy, and also the work done is of quality work. So this is really important to have when you're as a super specialty, as a clinic or as a hospital. It's very important to first take care of the emergencies and all the comprehensive work, and then of course let the patients also know that I am doing this also as an expert. That's how it becomes important.
Yeah, no, thank you.
Sir, LA sir has done
Yes.
it for over years.
I also started as a super specialist. In the place I was practicing, I started only as a cornea consultant, not even refractive, which I was specialized in. That brings you the name, like what Dr. Digvijay said, it will bring you the name. You have to continue to do that. I still continue to do that and visit other places. But what gives you the cream, maybe it gives the bread, but the butter and the rest of the things is actually general practice.
Yeah,
A successful super specialist is also a person who's a very good general ophthalmologist, actually. So that you covered it very
Yeah,
well.
that's what I was trying to say, that
Very nicely said, sir. Thank you so much.